And good evening, and welcome to this episode of the Your Health is Important Ask Dr. MJ Facebook Live Instagram broadcast. We're so glad that you chose to join us here this evening because we got lots of great medical information that we'd like to share with you. So give us a call or tune in right now. You know how it goes. I'm going to give a brief introduction, and then we're going to do the roll call, see who's here and join us. Give us your name and where you're logging in from. Thank you so very much. So I want to give a special shout out also to my production crew, Heilig, and his crew do such a phenomenal job in screening the calls and getting up the information for us. We're going to talk about new products that are coming out. As you can see, the CMOS product, the immunity mushrooms, and the women's lipo B for ladies. You're going to get it. It's going to be absolutely incredible. So you can unlock the ocean secrets. Peak Health with Dr. CMOS, that's going to be available right now at the introductory price. Regularly $69, $20 off, $49. And it talks about all those great things that you get for CMOS. CMOS is an absolutely amazing supplement. And so you will see all those things that you want to do with it. So we have expanded the product line because there are people that want to use supplements that don't necessarily need to or want to lose weight. They just want to be healthy. And so that's where we are with these products. Remember, all of our products are tested. All of our products are highest standard. And so you don't have to worry about if it says that what it's got in there. If it says it's got 200 milligrams or something, guess what? It's got 200 milligrams of that product. There are no fillers. There's nothing that you have to worry about from that perspective. So the immunity mushroom, the women's libido booster, go there. Go to the LipoDrops website, lipodrops.com/doctors CMOS/ and you can get more information about that. So this morning on the Rickey Smiley Morning Show, we were talking, and I got lots of questions about this. So I said, guess what? I'll introduce and start the show talking about this. The question is, we are officially now in the flu season, the cough, cold, and flu season. And so people are getting their shots. And when they go to the pharmacy now, they are promoting this concept of doing two things at once. If you've watched a football game or Sports Center or First Take or any of those sports shows, they have a commercial that's featuring the gentleman from the Kansas City Chiefs, Travis Kelce, and it ends with a shot of his arm, and it's got two Band-Aids on it. It say do two things at one time, and so he's gotten two shots. He's got the COVID shot and the flu shot at the same time. He's also got them in the same arm. Now, the question is, should you do that? And the Dr. Collier's answer to that question is no, you should not. One, you should have both vaccines. Two, if you're going to get them both at the same time, I would get one in one arm and one in the other arm. They oftentimes will offer you two in one arm in your non-dominant arm. So if you're right-handed, they're going to offer it to you in your left arm because your arm will be sore. And so they're advocating that if you're going to have a sore arm, you don't want it to be the arm that you have to use. Well, if you get both shots at the same time, the incidence of side effects increases by 28%, basically, let's say 30%. So 1 out of 3 people will have worse side effects than they would have had by getting either injection by itself. So either the flu shot or the COVID vaccine shot. And then the question is, does it compromise the immune response? Just like when you try to multitask and do two things at one time, both of the things that you're trying to do are compromised because you can't do two things well when you're doing more than one thing. It's just better to do one thing, complete that task, do it to the highest of your ability, and then go on to the other task. That is, your body's immune system works exactly the same way. Now, the concept is not new. In pediatrics, children go to the hospital all the time or to the doctor's office and get multiple shots at one time. And they'll get them in the thighs, they'll get them in the arms, depending upon their age. So it just kind of depends. But oftentimes, when children's immune system are young, they work better than ours. They are able to handle that challenge much better than an adult, particularly a seasoned citizen. I say somebody that's in their 5th or 6th decade, ages 50 to 60 or whatever. The immune system is just like they have to give a higher dose of the flu shot to those people that are considered elderly. They give higher doses of several vaccines for people that are considered elderly because their immune system is blunted by a decreased functioning immune system because of their age. Well, in this situation, it's the same exact thing. You're challenging your immune system to give you protection to two totally, completely different disease states. So my recommendation as a medical professional is not to do that. I tell people go and get one shot, and the one that I'm recommending you get initially is the flu shot. Get it now. The flu shot does not make you sick. It does not give you the flu the way that it used to. It literally used to be live flu virus. It was actual flu. Then you took it, you got a shot, you got it, and hopefully you had a mild case, but sometimes you didn't. And so Dr. Collier wouldn't take the flu shot then either. But now the new flu shot, it's not that new, but it is now the flu shot that's available to you. It's not one that will make you sick. There's nothing disease causing in it. So you can get that. And then 2 weeks later, I would get the new COVID booster. The reason that I'm giving you that pecking order, one, the flu is more important. The flu kills more people than COVID ever has and ever will. Two, we're in the flu season now, and most people have had COVID boosters or have had COVID itself, so they have some natural immunity. Whereas the flu is new. You have no natural immunity to it because it's a different virus every time it comes around. So you want to get that protection there first and then get the COVID shot 2 weeks or more later after getting the flu shot. Now, also, Dr. Collier recommends when you're getting any vaccine, and so many people are now getting this shingle shot and getting the pneumonia shot and all these vaccines that are available. The day one, you need two things. You need a non-sedating antihistamine, such as Claritin, Zyrtec, Allegra, Zylol, and an anti-inflammatory, Motrin, Advil, Aleve. Tylenol is not an anti-inflammatory. If you are taking, however, any blood thinners like Coumadin or Plavix or Eliquis, then you can't take an anti-inflammatory. So if they say don't take aspirin, you can't take an anti-inflammatory, you can't take Tylenol. And Tylenol is better than nothing. So if you're compromised, you can't take an anti-inflammatory, take Tylenol. But ideally, for regular people that don't have those restrictions, an anti-inflammatory is a treatment of choice. You start taking it the day before you're going to get the vaccine. So you've taken the anti-inflammatories are 2 or 3 doses a day. The antihistamine is 1 a day. So you take it the day of. You take it before you go get the shot. So the day of, the day before, the day of, and then the day after. So a total of 3 days of therapy that will decrease, limit, or prevent your response to the vaccine. So you should not have swelling. You should not have pain. Should not have fever. You should not have chills. All of those things will be minimized or completely blocked. However, your immune response to the vaccine will not be. So you will not be compromised in that respect. There were some people that were saying, oh, well, you have to go through that. That's your body is getting used to the immune. No. The immune system will respond without all of that if you block the inflammatory response, which is what we're talking about here. The allergy/inflammatory response is what we're trying to capture. So you do that, you'll never know that you got the shot. You'll be able to continue your usual activities. You don't have to plan, well, I'm going to be sick after taking that vaccine, so I'm going to have to take a couple of days off, or my weekend is going to be ruined, or something to that effect. So no, you can do that. So, but convenience trumps everything. This is the catchphrase that I heard. Convenience trumps everything. So if you say, well, I don't have time, I don't want to be running to the pharmacy or to the doctor's office and get another appointment, so I want to get both of them while I'm there. So if you know that in your heart of hearts, you're not going to go back and get the second shot, then get both shots. And this just increase. Still follow the guidelines that I just recommended to minimize potential side effects. But having both is better than only having one or the other. So, but if you plan, and this is what we're talking about, and at this time, you can literally walk in virtually any pharmacy and get these shots without an appointment. Now, that will probably change in the next few weeks as people are getting sicker and sicker and the weather changes, etc. But for right now, you can walk in and get a shot. You walk in and say, hey, I want to get a flu shot. It'll take you 10 minutes. And then a couple of weeks later, you walk in and get the new COVID vaccine. It is not a booster. This is a new vaccine that targets the most recent variants of the coronavirus, particularly the Omicron and some of its subvariants. So it gives you greater protection. Okay, that's it. So, Alec, let's go to a roll call. I'm going to take a sip of water. And let's see who we got listening tonight. Okay, Audrey Ngalu from New Orleans. Thank you, Miss Audrey. And we hope that all is well in New Orleans. We know that you're there on a special mission. Todd Jr. from Indianapolis. Hi, Mrs. Todd. We thank you so much for tuning in from Indianapolis. Sean Big Time Green, my man. Sean was one of the first male followers that we have for this event, and we're so glad he's there. Ursula Clark Holmes. Hey, Ursula. You didn't tell me where you're from, but we're glad to see you. Okay. TJ, Mr. Johnson, Albany, Georgia. Thank you, Albany. We are in the house. Sharita Ward, good evening, Sharita. So glad to have you back again. She is a regular as well. C.L. Turner, good afternoon from Baton Rouge, New Orleans, and Louisiana, once again in the house. Rachel Harrison, hello, Rachel. Thank you for being here this evening. S. Blake, good evening from North Carolina. Thank you, S. Blake. Carlos Ward from Douglasville. Hey, Carlos, thank you so much for tuning in. We appreciate you. Ms. Diamond Page Hall, good evening, Diamond. We are so glad that you are here as well. Rosemary, good evening, everyone. Hello, how are you? Thank you for joining us this evening. We really appreciate you. Marnie Jackson, good evening from Tulsa, Oklahoma. We appreciate that. Zandra Johnson, hello, hello. Thank you so much. Okay, Miss Makiba Boland, thank you, Miss Makiba. Miss Makiba came in and picked up all things lipo drops earlier this week. We appreciate that. Tanya M. Hawkins, good afternoon from South Kakalaki. We appreciate you. Katrina Prentice, hello, Katrina. We appreciate you. Mimi Witcher, hey, Mimi, from Tampa, Florida, maybe in Atlanta right now. Lorraine Daniels, hello from Maryland. Hi, Lorraine. We appreciate you. Raquel Tolson, good evening, Raquel. I can't tell where you're from, but we're glad to see you. Carl Grimes from Pensacola, sending blessings. Thank you, Carl. We appreciate you. Jules Stovall Mitchell from Houston, Texas. Hope the weather in Houston is good this week. Denise Irby, good evening from Massachusetts. We are so glad that you have tuned in, Denise. Thank you so very much. Joyce Lee, also from Houston, Texas. We appreciate you, Joyce. All right. Carolyn Manick from South Carolina. Carolyn, all right. We got Texas. We got South Carolina. Linda Blair Cotton from Lansing, Michigan. We're now Midwest. Paulette Hood from Baton Rouge. What about New York, New Jersey, California? Winnie King from Terrell, Texas. Hello, Winnie. How are you? So glad to hear from you again as well. Trayvon Waters. Hey, Trayvon. Thank you for tuning in, sir. We appreciate that. Mary B. from Macon, Georgia. Macon in the house, just an hour and a half from Atlanta. So glad to see you. Sinyan Adela. Good evening from Marie, Houston, Texas. We are so glad. Tony Gianni from Atlanta. All right, Tony. Thank you so much for being here. Trayvon from Mansfield, Ohio. Okay, let's get to the questions, Havlick. We are so glad to have everybody in because we know you have things you could do, places you could be. But tonight, we're here to answer your healthcare questions. So let's go with it. Ronnie Cooper. My 30-year-old daughter is vitamin D deficient. She was prescribed a pill to take once a week. I told her you need to take it daily to prevent me from getting breast cancer. Am I right? No, the dose that she has, the dose that we have, the Doctor's D product is 5,000 international units per day, and it is a daily dose. The prescription strength vitamin D that Dr. Collier prescribes every day is 50,000 international units per day. So you only have to take that once a week. She doesn't need to take that one daily. They're only going to give her either 4 a 1 month supply or 12 a 90-day or a 3-month supply. But it's definitely a once a week dosing. So that is why they told her correctly, because the dose is 10 times what we're talking about. So the prescription strength is 50,000 international units per day. That will build up her deficit. And once she gets to a therapeutic level, a normal level of vitamin D is from 30 to 90. A therapeutic level is between 40 and 60. Ideally, you want to be between 60 and 90. That's cancer preventive, as well as boosting your immune system, protecting you from various types of infections, including viruses like the flu and the coronavirus, bacteria like the strep throat and pneumonia, and fungal infections like fingernail and toenail fungus, jock itch and scalp ringworm, all of those things. So great regimens. The doctor's doing it right. And so both of you are right. But the way it was prescribed is the way that she should take it. 1 pill, 1 time per week. I tell people, pick a day so that you will remember. I put on the label. I don't just say take once a week. I say take on Wednesdays or take on Fridays. She needs to put a reminder in her cell phone to remember to take it, because you'll forget to do it. Dr. Collier was on the once a week regimen, and you forget to do it all the time. So again, put it so that your cell phone goes off while you're available to take the medicine, like in the morning while you're brushing your teeth or in your morning regimen. And then when your alarm goes off, stop what you're doing and take the pill. Don't say, okay, that's remembering me to take my pill and reminding me to do so. And then you promptly move on to the next thing and forget to take it. It's easy to do that, particularly if you're not taking any other medications. You do not have to eat to take this medication. So it is good that you take it when you can. Okay, great question, Ronnie. Mary Maupin, what do you recommend for depression? One, depression varies in length. It can be acute or chronic in severity. It can be just mildly irritating to highly disabling, where you just curl up on the sofa, moaning and not getting up and handling the things you need to handle on a daily basis. So one, you need to be analyzed for by a primary care provider and or a psychiatrist or psychologist to determine the level of your severity. Sometimes depression is an appropriate response to what's going on in your life. If you're in a job you hate, if you got a boss that's getting on your nerves, if you have a significant other in your life that you can't come see eye to eye with, all of these things are things that you have to take into consideration. So so sometimes it's an appropriate response. If somebody passes away, a close family member or somebody that you love or even a friend, you're not supposed to be happy about that. So depression is an appropriate response to that, and you have to, quote, get through it. Now, but there's disabling depression that also can be exacerbated by a chemical imbalance in your brain between dopamine and serotonin, and that you get stuck in that cycle and that needs to be adjusted. And most of the medications that are out there to treat these disease states will readjust that chemical balance and hopefully get you back to a point where you can function. So if you have recognized that you have depression, there's a thing called the PHQ-9 that you can get off the internet. It's a survey that you take. It's only 9 questions, and it will determine whether you meet the criteria for a diagnosis of depression. You can download that and just answer that. And then once you do that, you can talk to your primary care provider, your OBGYN. But again, there are online mental health services available now as well that can even prescribe for you. So if not, I like to do mental health face-to-face. I don't like to do it telemedicine until a treatment program has been established. Now, once we got you on something and we're on the same page as to how you're going to be treated and how long you're going to be treated, then we can do that via telemedicine. But the first time, I want to see your body language. I want to see how you're dressing. I want to see the first thing you can tell when a woman's depressed, she doesn't put makeup on. She comes to the doctor's office, she has no makeup on. She doesn't have her clothes the way that you want to do it. So you know that something is not right just from the moment you walk in the door and you're in this person's presence. So things that we can do from that perspective. Okay, Mary, good luck with that. Okay, we're back. Winnie King. I'm having a little blood pressure issue today. 140/83. Usually runs 126/76. Taking meds. Is there anything else I need to do? One, yes, something may be stressing you out. The stress hormone may have you up. But understand, 126/76 is the perfect blood pressure. 140/83 is a normal blood pressure. The traditional normal blood pressure is 140 or less over 90 or less. So you're still within the range, and everybody's blood pressure fluctuates throughout the day, depending upon your hormonal status, what you're doing, whether you just got through increasing your heart rate with some vigorous activity, or whether you've been laying around doing as much nothing as possible. And so that is not a level that you'd have to be concerned about. I wouldn't call that an issue. I would just say that it's elevated. Now, if it continues to go up, if you notice some other issues like your feet swelling, etc., then something else is going on. So I would monitor your salt intake because that is the first thing that would make your blood pressure go up. You eat a bag of potato chips or you eat some salted nuts, and you can take your blood pressure before or after. You can take a puff of a cigarette. You take your blood pressure before you puff. By the second puff, your blood pressure is up to 20 points sometimes. So there are things that can acutely do so. If it's something that's mental or emotional that may have you stressed out, just woosah, relax, then recheck your blood pressure, see if that's down. But that's not a bad blood pressure. It is higher than you traditionally like, but it's still a good range. And so there are a lot of people, if I could get them down to 140/83, I'd be celebrating. So thank you very much, Winnie. Great question. Marnie Jackson. Also, what can I do if I'm having symptoms of menopause and miserable? If you're having symptoms of menopause, the definition of menopause is not having a menstrual cycle for a 12-month period. I get people that go 6 months, 7 months without having a period, then they have another period. Then they're not menopausal yet. They are perimenopausal. And that means around menopause. And when you are perimenopausal, you can have a lot of the signs and symptoms that you're describing because your hormonal status is all over the chart. So it's very, very important that you not do those things. That bioidentical hormone replacement therapy is ideal for you and something I'd recommend. There are over-the-counter products that you can get for menopausal symptoms. From what I understand, CMOS is very good for some symptoms of menopause as well. And that CMOS product might be something that you want to consider. There are what are called phytoestrogens. These are plant-based hormones that literally will give you the same benefit as taking the animal-based protein. And you can get them almost anywhere now. It used to be that you had to go to the vitamin shop or GNC or someplace like that. But no, now you can get these things without having to go through all of that. So Marnie, good luck with that. Let us know how you do. Okay. Craze Marlowe Live. Can Jardiance rough worsen on the kidneys? Nephrologist prescribed it that lowered GFR, but also lowered protein leakage significantly. Plant-based diet is enough to get off of it. I wouldn't necessarily want to get off of it. Jardiance has been an amazing breakthrough drug. It is predominantly used for diabetes, but what they found out was that patients with kidney disease that don't have diabetes. Now, if you also have diabetes, it's the perfect drug because it also helps protect your kidneys from the diabetes and it restores glomerular filtration rate function. But you don't have to have diabetes, and guess what? You get the same benefit. So now kidney specialists are prescribing this medication, even though its specific, its first and initial indication was for the treatment of diabetes, but nephrologists are prescribing it now. And it's just great because kidney disease is progressive. It does not cure. It just can protect and slow the progression of, and it may even arrest the progression of, but it won't cure it. So if you're on it and it's helping you, and it says that you say that it's lowered your protein leakage significantly, and proteinuria or protein in the urine is a key sign of kidney disease, then you might want to stay on that because there are not a lot of other options, and particularly drugs that don't have any particular side effects. And the side effects of Jardiance is it would help control blood sugar, lower your hemoglobin A1C, and make you lose weight. So these are all good things. And so compared to some of the other medications that nephrologists did traditionally, they didn't have a lot of weapons in their armamentarium. The only thing they could do is help treat the primary disease states that cause kidney disease. That would be diabetes and high blood pressure. So if you had diabetes, they want to try to help get your diabetes under better control. You have high blood pressure, try to get your blood pressure under better control. But the Jardiance actually goes straight to the disease state. So it's very important that you do that, and it helps you get benefit from it versus just slowing progression by controlling the disease. So this is a change in the paradigm as far as treating chronic kidney disease is concerned. And I think we're going to see this as a primary therapy. Now, it is a primary therapy, basically, but you're going to see people that are on this and on that uniquely just to treat their kidney disease. So you're on a good product now. I stay on it. You see the benefit. No reason to come off of it. And a plant-based diet is never enough to come off of once you have diagnosed CKD or chronic kidney disease. Okay, great question. That might be the question of the evening. Carlos Ward, what is the best supplement to take for brain health? Well, Carlos, there are several things, and I know that the CMOS is one of the things that people are recommending for brain health. There are several products that you see recommended on the internet and on television commercials that people are taking. Prevagen is one of them. I hear about that all the time. I have people that say it's the greatest thing since sliced bread. I have people that say it didn't do anything for them. I have no experience with it, so I can't endorse it one way or the other. But I would say everybody wants to improve brain health. Everybody's afraid once you get to the point where you start forgetting stuff like where are my car keys, where did I park the car, and all the little things that happen as we age. And the reason that they're happening is that our brain is a storage unit like a file cabinet. And once the file cabinet is full, you have to remove the old files to put new files in there. Your brain will do that, and it will do it automatically. The problem is it's a process, and it can take some time. And when that happens, sometimes you got a little brain fart. You wait, and then all of a sudden, the thing you were thinking about, or where you parked your car, or the person's name that's standing right in front of you,
pops right in your head. So that is not an abnormal brain function. That is not a sign nor symptom of dementia or Alzheimer's disease. None of those things. It's just a function of the learned and aged brain that is full of information that it has to resort and reshuffle when you do that. But there are, again, the best thing you do for brain health is keep yourself healthy. And that means keeping your blood pressure under control, keeping your weight down, keeping, if you have diabetes is highly associated with dementia. So you want to make sure that you're keeping your blood sugar control. But remember, Dr. Collier has 3 things that he recommends everybody take every day. Young, old, black, white, male, female, you name it. That Dr. Collier's healthy trio is omega-3 fish oil, vitamin D at 5,000 international units per day, and probiotics. Those 3 things will give you your best options to optimize your brain health. But again, I think that we're going to get some great benefit from the new CMOS product and see how that helps with the brain health as well. And also there's some prostate benefits for that we are all considering. So great question, Carlos. But those are the things I recommend. Ms. Tuck, thoughts on GLP-1 usage for weight loss? GLP-1s are the magic shots that everybody's talking about. The one that everybody's heard about. Ozempic. The product is semaglutide. It comes in 2 brand names, manufactured by the same company. It's the exact same drug. For weight loss, they call it Wegovy, and your insurance company may cover it for weight loss. For diabetes, they call it Ozempic. It's the exact same drug. But if you're not diabetic, your insurance company is not going to cover a prescription for Ozempic, but it may cover a prescription for Wegovy. Again, the exact same drug made by the exact same company. They are now trying to singularly get an indication for weight loss for the Ozempic product, and the FDA is resisting that because they didn't ask for that in the beginning. And so because they didn't ask for it, they wanted to go the route of having a second product by a different name, or the same product with a different name to call it that for weight loss specifically. Then that's why they're getting some hesitation from the FDA. The other option is a medication called Mounjaro. Mounjaro is a GLP-1 as well, but it works at 2 sites versus 1. I think it is a more potent product, particularly for weight loss, but its indication is for diabetes. So if you're diabetic, you get the Mounjaro, you will lose weight. The weight loss from a GLP-1 inhibitor is up to 30 pounds per 100 pounds of body weight. That is the exact same number that you are promised from a gastric bypass surgical procedure. So without having to go through a bariatric surgery, the recovery time and the surgical risk, you can get the same benefits from using GLP-1s. These are literally magical in reference to weight loss. But for people who either can't afford the $1,600 per month cost of these products, the insurance companies won't cover them, then you will lose weight by going to the LipoDrops website and benefiting particularly from a combination of the LipoDrops Maximum Formula drops and the Lipo Night capsules that you can take in the evening that literally make you lose weight while you're sleeping, from L-carnitine as well as green coffee bean extract. But it also has, guess what, melatonin in it. The melatonin allows you to get a good night's sleep. If you are stressed and you got so many things you worry about what you have to do tomorrow and you're not sleeping well, what happens is your body kicks out that stress hormone, cortisol. Cortisol makes you gain weight, particularly in the abdominal area. So if you're getting a good night's sleep, you don't have that cortisol effect and you lose weight. So this product is absolutely incredible in the way that it addresses weight loss, and in combination with the LipoDrops Maximum Formula and some of the other products that we have in the weight loss line, you will optimize your weight loss at much less cost than getting the GLP-1 inhibitors for the weight loss. Again, I've seen the GLP-1s at various weight loss facilities for as little as $500-$600 for a 1 month supply, but you can get all of our products for less than half of that cost and accomplish the same objectives in a good, healthy way that will alter your body's metabolism and allow you to not only lose the weight, but hopefully sustain and maintain the weight loss. Great question, Ms. Tuck. Makiba, I'm allergic to meclizine, and the pharmacist says that diclofenac is the same family. Will I be okay to take it? The medication we're talking about, Mobic or meloxicam, is what you're speaking of. And now specifically, if you're allergic to that, you could, because all of these drugs, they're not in the same class. The meloxicam or Mobic and Celebrex or Saloxabid are in the class of drugs called COX inhibitors or COX-2 inhibitors. They block inflammation by a different pathway. Diclofenac is a non-steroidal anti-inflammatory that's in the same class as aspirin, Motrin, Advil, or Aleve. So if you can tolerate those with no problems, then you will be fine. If you cannot take and have been advised not to take aspirin, Motrin, Advil, or Aleve, then you don't need to take the diclofenac, but you still can take the Mobic. But you say you're allergic to Mobic, so don't take it either. Then your only option, unfortunately, Ms. Boland, is Tylenol Extra Strength or Arthritis Strength. Again, which helps with pain very well, but it's not an anti-inflammatory. So if inflammation is the problem, and it's always the problem, then the natural anti-inflammatories would be vitamin D at 5,000 international units per day, which you received the last time we saw each other, as well as omega-3 fish oil. Those two things would help in combination. And there's some anti-inflammatory components to the sea moss as well. So we can try those things and see how we do. Great question, Ms. Boland. We appreciate you as always. Cecily Trice, can I do a total body cleanse after having COVID? Yes, especially if I've taken Paxlovid. Yes. The two things are mutually exclusive. You've had the COVID, you're over the COVID. The COVID is out of your body in 10 to 14 days. You're non-infectious after day 5. But at 10 to 14 days, it's out of your body. You're no longer having the effects of that. The Paxlovid has nothing to do with it. It's out of your system as well. So if you want to do a cleanse, you can. But the term is, what does total body cleanse mean to you? The term cleanse has been replaced, or it has replaced the traditional term of laxatives in most circumstances. There's no laxative section at the drugstore now. There are cleanses. There are one-time cleanses. There are one-day cleanses. There are 3-day cleanses. There are 7-day cleanses. So it kind of depends on what it is that you're speaking about. But the answer generically and generally to your question is, yes, you can safely do that with no problems. All right, great question, Cecily. Dr. Rickon Tolson, I have had flat feet all my life. It's causing me a lot of pain. A podiatrist suggested I have surgery on both feet. Do I think surgery is necessary, and will it help quality of life? Doc, it depends. The condition that you're suffering from is called plantar fasciitis, or sometimes when you're falling arches is what they used to say. And because in your foot should be arched up like this, or kind of like a banana is, like this. There is a sheath that covers your tendons that connects the toes here to the heel here. That normally should go up and curve, and it's being held in place like this, so that there's no direct pulling on the bottom of your foot where it attaches. When that falls down and it's flat, it's a flat connection that goes straight from point A to point B like that. It pulls at the heel here and causes everything from heel spurs to just pain and inflammation. That whole sheath of tissue that's kind of like saran wrap can get inflamed. That inflammatory process is called plantar fasciitis. Itis means inflammation of. Now, several treatment options. Conservative treatment therapies, stretching that back out. You can use, there are people that will use things like rubber balls. They will even use frozen balls. They will use things like tennis ball cans. There are things that you can get to massage the bottom of your feet. There are custom made inserts. When you can go to the Dr. Scholl's section at a store where you put your foot in this mold, and it tells you exactly what type of insert that you need. It's a very good, effective process, but you got to have a store that has that. And then you can have the podiatrist can make custom-made inserts for you that you will need to wear to get some relief. The thing is, all of those are conservative treatment options. You can get injections in that area if it requires that. Traditionally, if this is the bottom of your foot, they would take that needle and stick it straight up in your foot and inject there. Then somebody got smart and said, guess what? Instead of sticking a needle in there and walking on that puncture wound and making it hurt worse, you can go into the side. You go into the side of the foot and then inject the medicine right there. Much better relief, much less pain and discomfort from getting so. Those are all, that's the secondary treatment. The first things I spoke of are conservative therapies. The second is the secondary treatment, injections, oral medications, including steroids may help. And then surgery is always your final option. It can, because they basically just go in there and release that tendon sheath, so it's no longer pulling and straining, and they can stretch it out. It's a variety of different surgical techniques that they can do to do that, but they have to lengthen it. They can't cut it out and remove it, because then you wouldn't be able to curl your toes, and that curling of the toes is very important in your walking process. So you got to have that ability to do that. But what they will often do is take the tendon sheath, stretch it out, extend it. They'll cut it, and then create some lips, so that instead of it being here, it's longer here, so you don't have it pulling as much. So again, I tell people all the time, surgery is your final option. After everything else doesn't work, then surgery. Sometimes things may work for a while. You may get an injection and get great relief for a while, but it's going to require a combination of things, particularly the custom-made inserts. I've seen great responses to those, and you may find that's all. You just have to wear the inserts in all your shoes, and get multiple pairs so that you can change them out and not wear the same insert every day, because then it just kind of gets rancid. But you want to get multiple pairs of the custom inserts so you can change them out in shoes. There will be certain types of shoes that you will no longer be able to wear. You won't be able to wear slides. You won't be able to wear sandals. You got to wear something that can hold that insert in place, and then that will give you that relief. But I would definitely recommend trying that first, and then that gives you benefit, and I'm pretty sure that it will. Then you do that as long as you can, or as long as you get any benefit from it. But then again, weight loss always helps as well. Weight loss always helps, because the pressure that's going on the foot is directly proportional to your body weight. So if you lose weight, and I don't care how much you weigh now, losing weight, you can be small, you can be medium, you can be large. Losing weight will always help with that disease state. So great question. Next caller. Wayne Dunston. I had a bad cold. My hands broke out in hives. Now my hands are peeling. What do you think it is? Probably not a bad cold. Something else. Sometimes, however, your body can react to an infectious agent by desquamating or causing your hands to peel. It could be your hands. It could be your feet. There's actually a disease state called hand, foot, and mouth disease that can affects your hands and your feet and your mouth, just as it's prescribed. This usually is in children. So sounds like you're having an allergic reaction to something. What I would do is take a non-sedating antihistamine. One that works wonderfully with skin issues is Allegra. I would keep that skin moisturized so that it doesn't get dry, scaly, and peeling and itch. And then the highs are telling you it's an allergic response, and the Allegra would be great for an allergic response. But if it's if it's desquamating much, they're peeling so much that you got open wounds now, you need to be seen by the doctor, because you could get secondary infection that could be a major problem for that. Okay, great question, Wayne. Katrina Prentice, I work in the hospital, worked COVID and caught tuberculosis from a patient who is latent right now. So I don't want to take all the pills. Is there anything else I can take? No. If you've been exposed to tuberculosis, particularly if you work in a hospital, you're going to have to go through the regimen. It can be 3 to 6 months long. Once you have done that, then your TB test will probably always be positive. So the question will always be asked, and then you will respond, yes, I tested positive for tuberculosis in 2023. I took the medication for the prescribed period of time, 3 to 6 months, and now I'm hopefully tuberculosis free, and you should not have a problem with that particular. But in your professional environment, they require, I'm sure, tuberculosis testing on an annual basis, so every year. So you have to document and confirm that you have had the medication. It's actually not a bad treatment regimen. The pills don't have any substantive or significant side effects, but you just got to take them. And then you document that you did take them in doing so. So you don't want to, people just kind of say, oh, tuberculosis, TB. TB can create a whole lot of major problems in your body, including kill you. So you want to take that medicine to keep it under control. There are resistant variants of tuberculosis. So if you got one, you want to knock it. You don't want to just knock it down. You want to knock it out. And that requires you to follow the treatment regimen, which again could be as little as 3 months, as long as 6 months. It just depends. But the answer to the question is there's nothing else that you can do to substitute for that. Nothing else that can change that. You need to take that medicine, again, to ensure your own health, and that you also aren't infectious and spreading it to other people. Because you can, family members, all your family members, particularly immediate family members, spouse, significant other, children, anybody you be around, need to be tested as well for tuberculosis. Okay, great question. Stephanie Green, hi. I have a history of polymyositis, and I'm currently in remission. Regaining muscle strength has been daunting, and weight loss seems non-existent. Well, the biggest problem with the polymyositis, Stephanie, is that you have to treat it in the primary therapies with steroids, and the steroids, they don't make you gain weight, but they potentiate weight gain. I tell people, say, oh, that medicine made me gain weight. No, there are no calories in the pills. They don't do that, but they can alter your metabolism and make what you do eat convert to fat. So you have to be very conscientious about the types of foods that you're eating and the number of calories that you're taking in. So the key about polymyositis is that it results in a ascending muscle weakness. It starts off in your legs and your extremities, it moves up, and hopefully it won't affect your diaphragm. That's what you have to be monitored for, because if it affects your diaphragm, you're not going to be able to breathe. But for most people, it starts, they say it starts in the feet, goes up in the body, and then it just runs its course and it's in remission. And then it flares up for no apparent reason at another time. But the treatment of choice is steroid therapy. So you have to take steroids at sometimes challenging doses, and weight loss is an issue. But while you're in remission now, weight loss is something you can tackle. So every product in the lipo line is compatible with any treatment regimen that you own. There's no cross reactivities. There's no reason you can't take them. There's no stimulants in them. So you can take them. And particularly, I'd recommend the Lipo Drops Max. But the Lipo Night may work wonderfully for you as well. I personally think because polymyositis can be an autoimmune disease, that the probiotics help tremendously with autoimmune disease states, and that is why that's one of the things that Dr. Collier recommends taking on a daily basis. So Dr. Collier's Healthy Trio, once again, vitamin D at 5,000 international units per day, omega-3 fish oil, which is a natural anti-inflammatory and does great for this disease state, the polymyositis, as well as probiotics. Probiotics, just God's gift to allergies, autoimmune diseases, and all those sorts of things. They are natural. You can take them if you have a flare-up. They will help minimize the severity of the flare-up, but they will hopefully prolong and prevent you from having a flare-up as well. But if you do have a flare-up and have to take the prescribed medications, you can still take those medications, the supplements as well, and they will give you benefit as far as this disease state is concerned. This is a challenging disease state. I had a patient early in my career that I took care of, and I learned so much about polymyositis because I literally had to see her multiple times every day because of her disease state, and they measured the strength in her extremities, etc. And it was a daunting task, but she taught me a lot, and I learned a lot about this disease state that I can share with you at this time. So thank you, Stephanie. We appreciate you sharing that with us. Keep us and let us know how you're doing. Keep us informed as your study state. Okay, S. Blake. I was told that 2 small bumps on my eyelids were xanthomas. I've seen dermatologists and facial surgeons. Neither want to remove them because they're on my eyelids. What is it? One, you're in the wrong place. You need to see an ophthalmologist, not an optometrist, not a doctor that does glasses, but an ophthalmologist, an eye specialist. But xanthomas is a fatty collection of cholesterol, basically, that's under the skin. It can be excised, removed, etc. The point is you don't want to do anything that damages your eyelids or your eyelashes, because that can create a major problem with your eyelids growing inside, and every time you blink, you're scratching your eyes, etc. So this is a problem, but you got to have a doctor that knows what to do and how to do it. But these are benign. They just are there. They won't harm you in any way. You probably see them because they're on you, but nobody else probably does. So it's not even a real cosmetic issue. But again, you have to go to a ophthalmologist, an eye specialist who can take care of that. It is beyond the scope of practice for a dermatologist, and a facial surgeon deals with virtually everything else. But this is an eye problem. And so to do that, you need to be seen by an eye doctor, but not an optometrist who makes glasses and contacts, but an ophthalmologist who deals with everything and all things eyes and visual. Great question, S. Blake. Okay, the great, I love it. I suffer from diverticulitis, and I'm in the hospital at least once a month. I'm on 2 milligrams hydromorphone and also 1 daily hydromorphone. Is there anything I can do to change these flare-ups? Yes. Again, probiotics are amazingly effective in helping with diverticulitis, but diverticulitis means inflammation of. Itis means inflammation of. So you have inflammation of a diverticulum, which is like having an extra appendix or multiple extra appendices or even hundreds of extra appendices. Sometimes when they happen so much, they literally can't do anything but remove that segment of the colon that has those diverticulum in them. And the colon is like an upside down U, the base of which starts on the right side where your appendix is. It comes up, it turns 90 degrees, goes across your stomach at the level of the belly button. So across here and then down. So it's like an upside down U. Let's see if we can get you a U there, like that, with your intestines. And most common area to have a diverticulum is on the right side, because that's where you strain when you sit on the toilet, go, like that. That can pop out of diverticulum. It gets inflamed sometimes by things that you eat and things that they tell you don't eat nuts, don't eat seeds. You can't swallow things like watermelon seeds because they can get inside a diverticulum and cause a diverticulosis. But now, oftentimes, they just treat it with antibiotics and it goes away. And that sounds like what's going on with you. But ultimately, it can and may become a surgical problem. And once they cut out that segment, you just don't have that issue anymore. And so that's not again, as a patient told me, there's no such entity as minor surgery when you're the person being operated on. So I agree with that wholeheartedly. I don't care whether it's just taking off a few lumps on your eyes or taking off a mole on your body. When you are the person being operated on, there's no such entity as a minor surgery. So, but it may come to that because right now it's impacting your lifestyle substantially and significantly. You can't go to the hospital for a week every month. Makes it difficult to maintain your job status. And you lose your job, you lose insurance, and all kind of other issues happen. So talk to your provider about other options. But again, I would either take a probiotic product or eat some Greek style yogurt on a daily basis to calm down that inflammation in your intestines. They're also using now some of these new biologics, drugs that are used for colitis, ileitis, Embro being one of them. It started off as an arthritis drug, and now they're using it for inflammation of the intestines. And so they're using that and other drugs like it for the treatment of recurrent diverticulitis. So make sure that your provider is aware of these and uses these things in their practice. This is all new. And so if it's not the use and customary, or if the doctor doesn't feel comfortable doing it, you may have to request a consultation from someone who does do that. But again, diverticulosis that becomes diverticulitis can be a life-changing. So great question. Okay. T, how do I get rid of trichomonas? I keep taking antibiotics, but it keeps coming back. Okay, so I think you mean trichomonas, which is an infection of the vagina, or in the male, the male penis lining. The problem is not that it keeps coming back, is that you keep getting reinfected. So treating a singular person for a disease that can be treated sexually, this transmitted sexually, this is not an STD per se. This is not gonorrhea. This is not chlamydia. This is not syphilis, but it can be and is often transmitted sexually. So trichomonas, which is what I think you're saying, is a disease that you have to treat both patients at the same time, both partners. And again, and anybody else, if there's more than one partner, everybody's got to get treated, because if only one person gets treated, as soon as they get back in the group or with that other person, they get it again, it keeps coming right back. And so it's easy enough to treat. Treatment protocols include taking 4 tablets one time. That will do it. And then you can also take the same medication, metronidazole, twice daily for 7 to 10 days, up to 14 days, depending upon that. The problem is there has not been a test for men for trichomonas up till now. They now have a urine genetic pathogen test that not only tests for that, but tests for multiple other things that men traditionally could not be tested for. What we would do in the past is we would stick a swab, like a Q-tip, but it's a little thinner, up into a male's penis, break it out, and then culture it. We would test it for chlamydia, we would test it for gonorrhea, and then we just have a general culture to see what grew from that. Well, we're much more sophisticated than that now. You don't have to use a swab anymore. You can just urinate and get a urine specimen and do genetic pathogen testing, and it will test for 40 different organisms, things that you never thought about getting tested for, to find out whether you have any bacteria or technically trichomonas is not a bacteria. It is
a different sort of pathogen, like worms or whatever. So the thing is that it's easy enough to treat, and that you need to be treated, but your partner needs to be treated as well. You are describing the classic circumstance of the woman going to the doctor and being diagnosed and treated, and the man hearing about it but never doing anything about it, or being reluctant to go to the doctor, or going to the doctor and getting treated at a different time. So you get it, you get treated, he doesn't get treated, you have sex, you get it back, but now then he goes to get treated, now he's cured, but then y'all have sex again, then he gets it back. So it goes, it ping pongs back and forth. So that can be a problem. Okay. Next question. Okay. Stephen White, Stephen, diagnosed with necrotizing pancreatitis last year. Oh my God. What's the root cause of this? I don't drink, indulge in any type of illicit drugs. I'm 60, hospitalized 5 times for a total of 65 days. Stephen, no idea. We have no idea why people get necrotizing pancreatitis. It's basically where the pancreas just starts to eat itself. Pancreatic enzymes are very potent and a very important part of your digestive process. So you have pancreatic enzymes, amylase and lipase, and you also have insulin, which is made by the pancreas as well. Something happens to the pancreas where it starts to digest and or dissolve itself. Necrotizing means the tissue is basically dead and it's creating the problem. So we have that issue with that. So we don't know what the cause of it is. But again, this is a situation where I really like to use things like probiotics to help control the just your general health. Probiotics are good. Omega-3 fish oil, and the body's natural anti-inflammatory. This is pancreatitis. Itis means inflammation of. Vitamin D, the body's natural anti-inflammatory. At age 60, don't know why it happens. Most of the people that it happens to don't have a history of alcohol. It can be associated with excessive drinking and alcohol use, but you don't drink. And that's the thing. When it happens to somebody who doesn't drink, the question is why. And we honestly don't know the answer to that question. Anybody who acts like they do are just telling you a story. This is something that has befuddled and confused the medical community, or what I like to call a diagnostic dilemma. We don't know why. We just know what to call it. And really, the treatment is just supportive. We just give you IV fluids and give you food sometimes through your veins just to get you through it and allow the body to heal itself. In that circumstance, there's no medicine for necrotizing pancreatitis proper. They may put you on steroids, which is kind of what you throw at a disease state when it's inflammatory, but we don't know what it is. Sometimes antibiotics, because you can get secondary infection. The dead tissue can have bacteria growing on it, particularly aerobic, anaerobic bacteria, the bad kind, and create a really bad infection. So sometimes you're on single, double, or triple antibiotic therapy as well, but there's no pill, no treatment proper for necrotizing pancreatitis. It's just a matter of getting through it and then supporting yourself with those healthy measures that I discussed. Stephen, good luck with this. We hope, please keep us informed as to how you come out with this. Okay. Tiffany Hammett. Okay, will ACV help break up a 1 centimeter kidney stone? It can. This is specifically, and this is where you're using sound waves to do that. Depends on the skill of the technician that's doing it. So when that happens, again, there are people that are great at it. Some people that they just kind of put you in a tub and then the sound waves just boom, 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 and nobody's focusing on it. So if that's what we're talking about, then it can. But now that's really pushing the envelope as to the size of the stone. And they will try that because nobody wants to try to operate on to get a stone if they can help it. But sometimes they will. Sometimes they're able to thread a catheter through your urethra, up your bladder, into your ureter to capture the stone. It has a basket in there, capture the stone, they can pull it back out. But a stone that big may be too big to get through the ureter. So sometimes they literally have to go through your side, the lateral portion of your abdomen, go into the tube that comes from the kidney to the bladder. That's called a ureter. And it's captured that way and then try to repair the ureter. The problem is ureters don't heal well. And if it gets a kink or a clog in it, it'll back up your kidney function and cause a lot of problems. So they will try to break it up. There are several techniques that they use, sound waves being one of them, ultrasonic waves. The other are medications, chemicals that can dissolve a kidney stone if the kidney stone is made from uric acid. If the kidney stone is a calcium stone, nothing breaks it up. You got to go get it from that perspective. So don't let them wait an extraordinary period of time, because if that is an obstructing stone, it puts back pressure on your kidneys and damage is being done to the kidneys on a daily basis. So the longer they wait, the more damage is being done by to the kidneys. Now, amazingly enough, there are two organs in your body that can heal and regenerate themselves, the kidneys and the liver. So they will allow some damage to be done, hoping that you will ultimately pass the stone. They can break up spontaneously and pass. It happens all the time. People will just say, hey, I was literally using the toilet and I heard a clink and I looked down and there it was. But a 1 centimeter stone is really one of the larger level stones. And so chances of you passing that are kind of slim. Okay, Tiffany, great question. Okay, Angie Cage, what can you do for low libido? I can't do the hormone replacement because my mom had breast cancer. You can't do traditional hormone replacement, but the bioidentical hormone replacement therapy is one that you probably can do. If you're concerned, then I would get tested for the BRCA1 gene status. You can do that from a blood test to determine whether you are susceptible as well. But also our lipo product for women is going to come out, the lipo E for the women, that's going to be out soon. The Women Libido Booster will be out. It will help tremendously in doing so. But again, don't think that just because your mom had breast cancer that you are not eligible for bioidentical hormone replacement. You are not eligible for the traditional, which is estrogen and or progesterone for those, because those are linked specifically to various types of breast cancers. But your gene status can be determined, and you can decide or find out whether you're actually susceptible or not. You don't have to assume just because it's in your family that you have that gene. You may not have it, and then your mind can relax. You don't have that issue. But sometimes women will check. They find that they do have that. And there have been women that have taken a drastic measure prophylactically having mastectomies so that they never have to worry about getting breast cancer. They just remove the tissue. Again, most famous, Angelina Jolie did that. She had both breasts removed because she tested positive for the BRCA gene. And so that is something to consider. You need to have a great relationship with your GYN or a woman's breast specialist to get you through this, because these are the sort of questions that you want to have the answers to when you're doing that. Okay, final question, Havlick. Jackie May. Hello, what's the name of the meds you talk about to take at night? I'm on the LipoDrops Mac, and yes, it works. Thank you very much. What we're talking about is now the new product, the Lipo Nights. Lipo Nights is not a liquid like the drops. It is a capsule. You take 2 of them in the evening, and it has multiple things in it. It's got green coffee bean extract. It's got melatonin to help you sleep. It's got L-carnitine to help with weight loss and metabolism of fat. It's an amazing product, and I'm just sorry that we didn't come up with this earlier, because we could have been using this a while ago. And so it's out there now. We have put it on the website. It is available. You can order it, and that combination again will optimize your weight loss, particularly who doesn't want to lose weight while they're sleeping. And you get a good night's sleep because that melatonin. You're going to decrease that cortisol level. You're going to have decreased abdominal fat. You're going to be a lean, mean pie machine. You're going to look better. You're not going to have that belly bulge. So lose the muffin top with Lipo Drops. And now we're going to say lose the cortisol stomach with the Lipo Nights. There we go. Okay, look, it has been a plum-pleasing pleasure to be with you this evening. Thank you for tolerating my semi-hoarseness. I've been talking all day, and so I've had a few options where I had to. So thank you for doing that. Thank you for being here this evening. Why? Because your health is important. Thank you so much, and we appreciate you for being here as always. So as we take us home, it has been my pleasure to serve as your healthcare consultant this evening. Dr. MJ Collier, always here for you. Go to my website, go to my YouTube videos at AskDRMJ. And remember, on the Lipo Drops website now, there's a direct link to our live presentation. So when we do this, you don't have to try to find me. You just go to the Lipo Drops website and hit that link, and then you are also participating in the live presentation. So look, tell a friend. Don't keep this to yourself. This does not need to be a well-kept secret. Tell all your friends, tune in. This is an opportunity for them to get healthcare information at absolutely no cost, and it is high quality. We try to stay on top of so many different topics so that we can answer those questions that you ask. And if you have the questions, there are thousands of other people that have the same or similar. And when you ask it, they hear it and they get the information.
So share it with your friends, your family, your brother, your significant other, all those people in your life that you love. And we'll see you next time. Thank you so much.